The next assessment is of the visual fields, and this can be done by confrontation, first each eye alone. There are three different methods I will demonstrate for the peripheral fields. One is confrontation with wiggling fingers, the other is by counting fingers in each quadrant, and the final one is with the use of a white pin. The approach is similar, using all three stimuli. You stand approximately 1 meter from the patient, or if you were both sitting, you want to be such that your eyes line up. The patient is instructed to cover one eye, and you cover the opposite eye. Andrika, please tell me when you see a finger wiggling.
Now. 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 Now.
Excellent. We can do the same thing with finger counting, and I'm going to show you either 2 fingers or 1 finger. And you tell me how many fingers you see. Cover your right eye. Look at this eye. How many fingers?
2. 1. 1. 2. 1.
And clearly Andrika is getting all the stimuli correct. The final way is with a white pin. Again, cover your right eye. And tell me when you see this head of the white pin as white. And it'll be moving as well. Say now as soon as you see it.
Now. 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 Now.
You cheated, you looked at it. Okay, keep looking at my eye, please.
Now.
And just as in this example, sometimes you have to remind the patient to maintain fixation on your eye. We can also assess central vision with use of a red stimulus. And to assess central vision, you need a colored object. And so a red pin serves you very well. Here you're really looking at the 15 degrees or so of the vertical and central meridians. The lines, as if you assume that that is central vision. Cover this eye. Look at this eye. And Andrika, I want you to tell me when you see the pin as red. Say now as soon as you see red. How about up here? Do you see the pin? Is it red?
No.
What color is it?
It's black.
Tell me as soon as you see it as red.
Now.
Keep looking at my eye.
Now.
Keep looking at my eye.
Now.
And you can see that when assessing central vision, in fact, the visual field is much smaller than it was for the peripheral fields. Finally, using the red pin, you can assess the blind spot. And most people aren't even aware that they have one. This is done by, again, asking the patient to close one eye. And the blind spot is located about 15 degrees off the vertical meridian, just usually a little bit below the horizontal. You line up your eye against the patient's eye. Andrika, I'm going to ask you to look at the red pin and tell me when its head disappears.
Okay.
Okay, sorry, you're going to look at my eye, rather. Do you see the head of the pin? Tell me when the head disappears.
Now.
Okay, so I have to move my head just a little bit, and once I've done so, the head has disappeared for me as well. Tell me when the head reappears.
Now.
Gone?
Yes.
Tell me when it reappears.
Now.
Gone?
Yes.
Tell me when it reappears.
Now.
Gone?
Yes.
Tell me when it reappears.
Now.
Okay, gone?
Yes.
And you can see that there was a spot, known as the blind spot, where Andrika was unable to see the pin. When testing the visual fields in a patient, you assume that your own visual fields are normal.